Okay.
Good evening, everyone, and welcome to the first felicitation of our esteemed members who have been actively participating in the image competition. And earlier we used to do this felicitation every month, but this time we brought in a little change and we thought that let's do the felicitation together of 3 months together so that we have some interesting images to share with all our members. So I have our team who has been working day in and day out to do the assessment of the images which are submitted to VRSI. We have Dr. Naresh Babu from Arvind Eye Hospital, who's heading the team. We have Dr. Sangeet Mittal, who again is a very senior VR surgeon from Jalandhar. And we have Dr. Chitranjan Mishra, who has been working very hard to assimilate all the images submitted, and he is from Sambalpur. So I'll request Dr. Chitranjan Mishra to take this felicitation program forward.
No, ma'am. Before, I would like to request Naresh sir to say a few words. After that, also that will give us some time for few members to join. Dr. Naresh sir, please.
Sure.
Yes, thank you. Actually, first for all the participants for submitting their images, but unfortunately, we are a team of close to 2,000 plus. But unfortunately, the images we are getting is very dismal in spite of seeing so many cases in our OPD. So what I was thinking is like, I used to tell Chitranjan also, we should have the eye of a photographer or the attitude of a poet, something like that, seeing something abnormal in everything so that you will catch, because what is considered as a routine thing for you may be something amusing for others. So with this, I would like to, request all the participants to send in more images so that we'll be having more competition, number one. And number two, as we have told, we don't want to hold any copyright of these images. This is basically a competition. Once the competition is done, in case if you want to send this as a, what you call the cover images for any of the magazine or the journals, or if you want to send it as a cover, photo for any of the ASRS image bank or any other such image bank, you are free to do. And all you have to do is you just send a letter so that we'll remove that from our website. In the sense, the copyright will be removed so that the copyright remains with you. So you don't need to have the fear that it is copyrighted to what you call VRSA, like what is done in APVRS, because when we send a video to APVRS, it is literally copyrighted by APVRS. We cannot further share it in any other conference. So, and I would like to thank all the participants and congratulations to all the award winners. And regarding the award winners and the images, Dr. Chitranjan will be introducing them, and I would like to request them to make just a very brief, address about their images, just in 1 or 2 slides, maybe in 1 or 2 minutes, about the images and what amused them to send that image to the, the competition. Over to you, Chitranjan. Thank you.
I will just take a moment and welcome Dr. N.S. Murlidhar, who is the current president of VRSI. And I will request Dr. Murlidhar also to just encourage all the participants by a few words.
Good evening, everyone. I'm so glad that Manisha and Naresh Babu have organized this felicitation program. It is nice to see participation in the image competition of VRSI, but I want more and more participation in this, so that let's get many people to take part in this. And I thank the team led by Dr. Naresh Babu, who have taken the task of judging these images, collecting these images and sending it for judging, sending it for voting, and collecting the results and announcing. Very nicely done and very efficiently done. And as Naresh Babu has already emphasized, these images are not copyrighted to VRSI. So therefore, you are free to send these images to any other form of, this one, like, cover page of any journal or any other competition in any other forum also. So that should not deter anyone from giving their best images. So So I congratulate all the winners, and please spread the message to your friends. You also, try and send in good images. Let's get more number of images. And I once again thank all the team involved in this image competition for their excellent work. And please continue to do this, and let us take it to even a greater heights. Thank you so much.
Over to you, Dr. Chitranjan.
Yes, sir. Thank you. So definitely both of Dr. Muralidhar sir and Dr. Naresh sir, they have cleared a very big doubt. This is a very frequently asked question from all of the image submitting doctors. They are telling that what will happen to my image. So there is no copyright issue. That is very nicely cleared the doubt. Thank you, both Naresh sir and Muralidhar sir. So now coming to directly to our felicitation ceremony. So now we are going to felicitate the winners of the month of April, May, and June 2022. So now coming to first April, the month of April. In the month of April, the third prize goes to Dr. Harshit Vaidya. Dr. Harshit Vaidya works in Vaidya Eye Hospital. He is an alumni of SN Chennai. He is also a freelancing VR surgeon. So without wasting time, may I request Dr. Harshit Vaidya to please present his PPT of 2 slides regarding his image, that is teardrop on a hat sign, which gave him the third prize. Dr. Harshit, please. Dr. Harshit, are you sharing your slides?
Chito will move on. Chito, he can join us later once he's ready.
Sir, he is there, sir. He is there.
He's there,
I have seen
but okay.
Manjula madam, any technical issues?
No, doctor. No.
Yes, yes.
Dr. Harshit, if you can switch on your video so that we can see that you are there.
Yes, ma'am. I'm just trying to figure that out, ma'am. Just give me a moment, please.
Yes, yes.
Is it on right now? Because it's my video is showing on, ma'am.
No, I think you have to share your video. It's not shared, I think. And your video is off. Only your mic is on.
Video is showing on here. Okay.
Dr. Harshit, please share your screen.
Please share your screen, Dr. Harshit.
Yes, sir.
Yes, yes.
Are you able to see now?
No.
No, not.
I will request Mrs. Manjula to help Dr. Harshit, and then if we can move on to the
Yes.
Okay.
Yes.
So should I go ahead, ma'am?
Yes, yes.
Yes. Make it full screen.
Yes, sir. Just a moment. Good evening, everyone. Thank you, VRSI. Thank you, ma'am. Thank you, sir, for involving me in this presentation. So this image that was selected in the month of April was this won a second prize. This was termed as teardrop on a hat sign. So basically, there's a disclaimer and a disclosure here. This image was also published in the Indian Journal of Ophthalmology case reports earlier this year. And the title of that was teardrop on a hat sign in case of a vitreomacular traction. Here we're explaining the vector forces on optical coherence tomography imaging. Now, so this patient was a 59-year-old female. She came to us with the complaint of diminution of vision in the left eye for 8 months, and her best corrected visual acuity in the right eye was 6/9, and the left eye was accounting finger 1 meter. She was phakic, and there were barely any lenticular changes. Also, her fundus in the right eye was unremarkable. The left eye had a dull foveal reflex with a bit of RP alterations, and the peripheral retinal examination was essentially normal. We went ahead and did a optical coherence tomography, and this is the peculiar image that we ended up finding. Now, on the first glance, I was, it didn't really strike me that it could be of much significance. But I wanted to understand why why the cyst was formed, why the a hat-like shape was formed inferiorly in the macular region, the hole. So I delved a little deeper into it, and I realized there are a couple of, it kind of increased my own knowledge of the vitreomacular traction. And here we could see that we're aware that there are two forces that take place in a VMP: the horizontal tractional force and the vertical tractional force. So the horizontal tractional force, invariably, we have known that it causes a pseudocyst formation, whereas the vertical tractional force is the one which causes the elevation of the fovea and causes the foveal detachment and a full thickness macular hole eventually. And this is what prompted me to make this image. I did a bit of literature search. I found this article to be pretty interesting. All these three articles were quoted in my published article. And if anybody is interested, this idiopathic macular hole, the direction and vitreomacular traction, the structural changes and surgical outcomes, this kind of gives us a pretty good overview of the vector forces, as we mentioned here, the alpha and the beta. So basically, if I can take a minute more the alpha angle is basically the horizontal tractional force is the one which takes precedence, because the angle here is less than 45 degrees. And if the angle formed by the vitreomacular traction is more than 45 degrees, that causes a vertical tractional force. And these are the ones which cause the peculiar changes on the OC. Thank you, ma'am. Thank you, sir. That's
Thank you, Dr. Arshit. Chito, this is what I was telling actually.
Yes,
see, it's basically seeing a teardrop and the hat in the image actually. So this is what I was telling. Just be somewhat poetic or somewhat creative. It may not amuse you, but there are so many things which can amuse you. So identifying a hat in this image and identifying a teardrop, I think it would have been exciting for Dr. Arshit, which made him to submit this image. Over to you, Chitrendra. Dr.
Yes,
Arshit,
sir.
can you stop sharing?
Yes, sir. Yes, sir. I'm just.
Also, he has taught us some mathematics also, sir. Theta, beta, which almost we read many years ago. So thank you. So congratulations, Dr. Harshit. This is your certificate.
Thank you,
and Dr. Harshit wins cash prize of 2,000 rupees, which will be appropriately credited to your account.
Okay.
And congratulations, Dr. Harshit, again.
Thank you, sir.
Hearty
So
congratulations.
then, yes. Then we move on to the second prize winner of the month of April, Dr. Rusik Patel. He is working in Netralaya Super Specialty Eye Hospital, and the title of his image was Bad Retina. Bad Retina. So over to Dr. Rusik Patel. Rusik, make your video and audio on. Share your screen.
I think in the meantime, others can be ready with their PowerPoint open so that we can directly go into the business.
Yes. Dr. Rusik, are you getting ready?
I think the other participants at the end of the presentation, if they are ready, I think they should switch on their mic and the camera. So we don't know
Yes.
whether they are
Rusik,
there.
start sharing screen.
Are you visible? I mean, my slides are visible, sir?
No, you are audible only. Slides not visible.
Oh,
You have to share your screen, right?
We are still visible, Dr. Rusik.
Yes, yes, understood.
Oh, just a minute, sir. Uh, Now my screen visible?
Yes.
Thank you, VRSI, and good evening to all of you. My image was of a right eye of a 45-year-old female, diabetic female, having uncontrolled diabetic and diagnosed as a treatment name PDR with long-standing combined retinal detachment. When we do this swab source OCT, it showed pre-retinal fibrovascular membrane uh, causing traxal detachment, except two focal attachment with underlying RPE. And these two focal attachment of same size resembles two lower limbs of the bat, while elevated NSR resemble wings of the bat. These two focal attachments may consist of an photoreceptor matrix glue made up of glycosome and glycans, and the interdigitation between RP microvilli and the photoreceptors. Now, development and subsequent contraction of fibrovascular membrane in PDR cases causes the traction on neurosensory retina, which overcomes the above described mechanical forces in the subretinal space. Thank you, sir.
So thank you, Dr. Rusik, for a very crispy presentation. So both of these images actually show that we should think beyond our retina only. So like somebody is seeing teardrop in a hand, somebody seeing a bad retina. So thank you, as our listeners have told. Yes. Thank you very much, Dr. Rusik. May we have the certificate for Dr. Rusik? Yes. Congratulations, Dr. Rusik. And
thank you, sir.
He wins award of 3,000 rupees, which will be credited to your account appropriately. Congratulations again, Dr. Rusik. Now, yes, welcome. Now we move on to the first award for the month of April. A very nice image by Dr. Akanksha Sarma. She is doing BR fellowship in Dr. Nagpal's hospital, Ahmedabad. So over to you, Dr. Akanksha. Yes.
Good evening, everyone. Thank you for selecting my image as the first winner of the BRSI image competition. I hope my screen is visible to everyone.
Yes, visual and you are audible.
Right, sir. So I'd like to begin. My patient was a 47-year-old male patient who had presented with diminution of vision in his right eye for a period of 2 months. And he gave a history of cataract extraction with IOL implantation around 3 years back. At the time of presentation, his vision in the right eye, which was the eye where the complaint was 6/9, but it was with the +10, and he was aphakic. Upon the posterior segment examination, as you can see on your screens, this is a color photo of his right eye, where the IOL that was implanted was lying over the retina. Now, the interesting part was that we could capture an infrared image of this eye because of the modality, which is a multimodal imaging modality, and that is SLO based, which is known as Mirante in our institution, where we can see the beautiful contrast between the black and the black background and the IOL. Which I found interesting, and hence I'd like to share it with the BRSI image competition. So we diagnosed the patient to have a IOL drop in his right eye, and for his right eye, pars plana vitrectomy with IOL explantation with a secondary IOL implantation was conducted at our hospital. However, the patient was lost to follow-up. So thank you.
Thank you, Dr. Akanksha. Any comments on this, Dr. Sangeet sir or Naresh sir? This is the first prize.
I think it's a very nice image that she had captured, because it's very difficult to capture something in the vitreous and also the retina, both in good focus. I think she has done a very nice job, and it really deserved the first prize.
Thank you so much, sir. Thank you.
Thank you. So here is the certificate for Dr. Akanksha. Congratulations for winning the first place, and she wins cash prize of 5,000 rupees. Before we move, just one question to you, Dr. Akanksha.
Yes.
when we take these kind of images, the patient in the sitting position, usually the lens tends to gravitate below. But you have captured nicely, very nicely. So, did you do any manipulation of the patient's eyes or
Yes,
anything?
actually, the congratulations for Mirante, not for the person. Taken the panoramic view of the camera is good.
Yes, sir. Yes.
Sir, in Mirante, the Mirante actually gives a wide field view of around 163 degrees. So, sir, it is our daily protocol at Retina Foundation that, sir, we slightly, extremely slightly tilt the head towards the direction we want the image at. And sir, just that and nothing more. And sir, also in different quadrants we can take. Like in this patient, since the IOL was dropped inferiorly, so we asked the patient to look slightly down and we could capture this image. Also, sir, images can be taken in retro mode also in the wide field in such cases. However, so the contrast for the retro wasn't that great, and hence I uploaded the infrared image for this patient.
Great, congratulations. So, in Retina Foundation, your colleagues and the staff will be waiting for a treat from you. So,
Right, sir. Thank you so much. Thank you.
Thank you. Thank you. Thank you. So then we move on to the month of May 2022. And in the month of May 2022, for the third prize winner, Dr. Bhavani, may I request Dr. Bhavani, a very hardworking, our junior colleague from Arvind days, very nice doctor. Her image was a full thickness macular hole secondary to Best's vitiliform dystrophy. So Bhavani, can you please share your screen?
Good evening, everyone. Thank you, Chitranjan sir, for that those words about me. And am I audible and are my slides visible to everyone?
Please proceed.
My image submitted for the contest was a case of macular hole in Best vitiliform dystrophy. It was a patient who was, the patient was 18-year-old male. He had a defective vision in the right eye for the past 5 days when he presented, and he gave a alleged history of accidental trauma to his right eye with a cricket ball, following which he developed defective vision in that eye. And his best corrected visual acuity at the time of presentation was 6/36, and his intraocular pressure was quite high, 31, with angle recession or gonioscopy. And this fundus photograph, when I examined the patient, I could see a macular hole, and with the history, I could relate it to a traumatic macular hole. But what intrigued me more was the hyperpigmentation which was seen right beneath the hole, surrounded by the subretinal yellowish lesions. So then the surprise awaited when I looked for the left eye as well. The left eye also showed a similar hyperpigmented lesion close to the fovea, surrounded by subretinal yellowish lesion. So this made me think in terms of the age as well as corresponding to these findings. Possibly it could be a Best dystrophy for the patient. So then when I ordered for an OCT, I could find a full thickness macular hole in the right eye and the hyporeflective space in the left eye just beneath the ISOS junction, between the ISOS junction and the RPE, along with few hyperreflective filament-like processes right beneath the ISOS junction, suggestive of a Best macular dystrophy. And I could also see some vitiliform deposits through a line scan right beneath the fovea. And coming to the fundus autofluorescence, it also supported this diagnosis by hyperautofluorescent lesions which were seen surrounding the area of hypoautofluorescence, both in the right eye as well as in the left eye. So I could come to the conclusion of a both eye Best macular dystrophy associated with a macular hole in the right eye. So the patient is advised right eye pars plana vitrectomy with internal limiting membrane peeling followed by SF6 tamponade. And macular hole in a patient with Best vitiliform dystrophy can either be spontaneous or it can be following a blunt trauma as in this patient. And thank you everyone.
Dr. Bhavan, you can stop sharing your slides.
Dr. Bhavani, nice images. I think that was taken in the Claras 500 where you can take in the single capture 133 degree and with montage you can go beyond 200 degree. Good job, nice image. So congratulations, Dr. Bhavani, for the third place.
Thank you.
And she gets award of 2,000 rupees, and which will be appropriately credited to your account. Then we move on to the second winner of the month of May. But recently we got a message, Dr. Rosni. She is Dr. Rosni Mohan. She has done the VR fellowship in Arvind Hospital, Madurai. She is working as a medical officer in Arvind Hospital, Pondicherry. But due to some health emergency in her home, she has sent a message that she will not be presenting. So her image was multiple berries in the eye. That was a case of retinal cavernous hemangioma. So may we display the certificate for Dr. Rosni? Dr. Rosni. Yes, good. So congratulations, Dr. Rosni. She wins cash award of 3,000 rupees, which will be credited to her.
Dr.
So
Chitra,
then we,
have the image you can show if you have the image in your this thing.
pardon, sir?
If you have the image in your
I don't think we have the image.
okay.
We have not
No,
made
we
the
You
image.
we don't have the image with us?
Yeah.
we-
No, we have some, not right now.
Not right now. Like we
Not right now.
expected.
Okay, fine.
To present just to, so that's why some sudden health emergency. That's what she messages now. Only she is the only candidate who is not present in this meeting. Rest of them are present. So with this, we will move to the first prize of the month of May, which is owned by Dr. G. Santosh. She is a fellow in Dr. Girdhar's Eye Hospital, Kochi, Kerala. So her title of the image was Macular Fireworks. May we request Dr. G. Santosh to please share the screen. Dr. G, you are muted. Please unmute.
Yes, sir. So this was the prize-winning image for the month of May, which I had submitted for the VRSI competition. So this was a spectral domain OCT image of the macula. It was quite a simple diagnosis of a patient, a 45-year-old male treatment-naive patient with proliferative diabetic retinopathy who happened to have a premacular hemorrhage. That is all that the patient had. And we fellows take the imaging here. So when I happened to capture this image, I had never seen something like this. And it looked pretty good. And I thought I should send this to the image competition. And that is what it is. This is a patient with a proliferative diabetic retinopathy. And the hemorrhage happened to come out in the shape of a firework. So I thought of giving the name of macular firework. So that is all about this image. And can I move on to one more image, sir? Because of short of time. This was another image for the month of July, I think.
Is not presented.
For the month of July. Sorry, sir?
No, in that.
No, you can wait for the next month if you want.
No, please wait. It will not take much time. Please wait.
Okay, sir. Okay.
Yes. Thank you. Dr. again. So that is a nice image. Any comments from Dr. Naresh sir, Dr. Murli sir?
I just have one comment that it's a beautiful image and it also highlights the level of imagination people are having while capturing these images.
Yeah, I also congratulate the doctor on taking this image. Very, very nice and aptly titled. And I also have never seen something like this before. So congratulations, very good image.
Thank you. Thank you.
And this
So,
also
Chittaranjan,
highlights
as we have been discussing, it's basically having a different perspective about these images. Because this can be passed off as a normal, blood, pass it off. But some creativity makes the people to see something different. So that's what we have been requesting from the beginning. So you see something different, so that we'll have more images.
In the beginning, anything, it may not look amusing to present, but then when you think about it and you present it, it may turn out to be something else.
Yes.
I congratulate you, Dr. this,
Thank you,
this
sir.
beautiful image.
Thank you, sir.
Congratulations, Dr. Jeez. Can we have the certificate for her? Yes, congratulations again. So she wins a cash award of 5,000 rupees, which will be credited to her. Then we move on to the month of June. So in the month of June, in the third place, we have Dr. Kusal Diliwala. So he is again alumni of SN Chennai. He works in Nethralaya Super Specialty Eye Hospital, Ahmedabad. Very good friend. And may I request Dr. Kusal to please share his screen. Dr. Kusal.
Is my screen visible?
Yes, Kusal, please proceed.
Okay. So good evening all. Thank you VRSI for this opportunity. And also I would like to thank the fellow ophthalmologists who voted for my image submission. So the title was Preretinal Hemorrhage with Radial Hemorrhage in Henle's Fiber Layer. So this was the image which I had submitted, and there was a beautiful premacular hemorrhage, and there was also peculiar radial retinal hemorrhage, which is probably due to the accumulation of blood in the Henle's fiber layer. So I'll come back to the image again. This was of a 30-year-old phakic male who presented with left eye sudden onset blurring of central vision for 4 days and was not having any systemic comorbidities and an eccentric visual acuity of 6/16. So here we can see again the image where there was this feathery pattern of this retinal hemorrhage, which probably was in the deep retinal layer, as well as there was some breakthrough retinal hemorrhage. And based on this, patient was also systemically investigated and was diagnosed to have anemia, probably as the underlying etiology, and was referred to this physician for further anemia management as well. However, it was a pre-COVID time and I was not able to trace the patient back to have his follow-up image for the resolution of the retinopathy forward. So coming to this Henle's fiber layer hemorrhage, which has been also labeled as either HH or HFL hemorrhage. So why usually it happens? Because there is abnormal retinal venous pressure which is raised in the deep capillary plexus, because that is the major level of venous outflow in the retina, and probably due to that. And secondly, there is a peculiar anatomical arrangement of the axons of the cones and rods in the Henle's fiber. As we know, they are obliquely arranged. However, if we go out of the fovea, it becomes vertical. So probably due to this oblique arrangement of these photoreceptor axons, the hemorrhage gets accumulated along the direction of fibers and gives this unusual appearance. So thank you very much once again.
Thank you, Dr. Kusal. He always submits very nice images and he has so many cover page images to his credit also. Any comments for Dr. Kusal? Compliments from the panel, please. If not, we will move to the certificate of Dr. Kusal. Yes. So congratulations, Dr. Kusal. Yes, ma'am. You're telling something?
Hearty congratulations and a very beautifully captured image.
Yes, ma'am. Definitely. So congratulations, Kusal. Yes. So he wins award of 2,000 rupees, which will be credited to his account. So thank you again. Then we move to Dr. G's again. Sorry, Dr. G's, to make you wait, but we have to follow the protocol. That's why. So Dr. G. Santosh again, as we have told, she is a VR fellow in Dr. Girdhar's Hospital, Kochi, Kerala. So the second prize goes to her in the month of June. The title was Hemorrhagic Pigment Epithelial Detachment. So Dr. G, please share the screen.
Hi everyone again. So this was the image which I had sent. This is a multicolor image again taken on the Heidelberg machine. This patient was a newly diagnosed patient of a peripapillary polypoidal choroidal vasculopathy patient who had a hemorrhagic PED, and this image was captured on the multicolor imaging. So the thing about multicolor imaging is that we can see it's an amalgam of, it's a pseudo color imaging. It's formed by the laser images, and there are three wavelengths, the red, green and blue wavelengths of light, which can show and highlight fundus etiologies, fundus problems at different levels of the retina. So the superficial things take up a blue reflectance. So that is why we use it more for the mactal etiologies, and the deeper layers we utilizes the red. For a normal, as seen in this picture, a normal fundus photograph may not pick up as much detailing of the pathology as a multicolor image does. So in our institute, we use a Heidelberg. This is an image which this is the machine we use to capture both the images. Thank you.
Congratulations again, Dr. G. So you have won 2 awards probably.
Yes,
1
sir.
award treat for your hospital and another one for the AIOS when you go to AIOS Kochi at that time.
Yes,
For
sir.
us. Any comments on this image from the panel?
No, I think she should be as enthusiastic as she has been for submitting these interesting images. And I'm sure her team members are not going to leave her without a treat because she's won 2 awards.
Yes. So, yes, congratulations again, Dr. G. So she wins cash award of 3,000 rupees.
Thank you.
Which will
Thank
be
you.
credited to her. Yes. So then we move to the first prize of the month of June, a very nice image, multimodal imaging of bilateral, symmetric, vessel, laminar, brucine. Dr. Mahak Bhandari. She is doing VR fellowship in same Dr. Girdhar's Eye Hospital, Kochi, Kerala. Dr. Mahak, please.
Hello everyone. Thank you for giving me the opportunity to present at this platform. So this is the image that I had submitted. Am I audible?
Yes, yes.
I think you have two devices connected.
Yes,
If you could switch off one.
Correct.
Just a second. Is it better now? Yeah. This is the, as Jess had already mentioned, this is the imaging system that we use in Girdhar Institute here. This is a Heidelberg Engineering, German technology. And going to the history, just a brief history, we had a 62-year-old male patient with a gradual diminution of vision in the right eye. The vision in the right eye was 1.2 meter, less than N36, and left eye was 6.6 N6. So basically, this is the fundus image of the patient. And as just had already mentioned, you can see the difference between the fundus image and the multicolor image of the patient. So basically, there were multiple PEDs in the patient, which is very much visible in the multicolor imaging. And therefore, I chose the multicolor image to submit for the VRSI. This is the SD-OCT image showing multiple tall peaked PEDs. And in the right eye, there was a subfoveal disintegration of the RP and the photoreceptors. Now, the striking thing, and that's why the right eye vision was poor. The striking thing was that all those PEDs had RP atrophy at the peak of them. And that is why we went ahead and we did a FFA and ICG of the patient. And we got the appearance of the PEDs, they started appearing very early in the arteriovenous space, and they gave a starry sky appearance, and that's why we came to a diagnosis, a final diagnosis of basal laminar drusen. And this was the ICG image. You can see the hypersynesy in the center, owing to the RP atrophy, surrounded by hypersynesy. So I clubbed the ICG and FFA image of this patient and gave it as a compiled imaging of this particular patient. So we in Girdhar Institute also have image contest. We are having a Silver Jubilee Symposium, and anyone who's interested can please apply and visit Kochi also. Thank you.
Congratulations, Dr. Mahak. Again, very nice and multimodal, truly multimodal imaging. Any comments on Dr. Mahak's image?
Yeah, I'd like to comment on this. Very nicely documented, Dr. Mahak. Actually, this is a condition which was first described by Dr. Sir Donald Gass.
Yes.
He named it like as IMPET, idiopathic multiple pigment epithelial detachment, and usually it occurs in middle-aged females.
Yes.
It's not a very common condition, very rare, and sometimes it may lead to development of choroidal neovascular membranes also. Very nicely, very nicely documented.
Thank you, sir.
Congratulations, Dr. Mahak. Can you have the certificate for her? Yes, yes. Congratulations. So she wins a cash prize of 5,000 rupees, which will be credited to her. So with this, all the winners are presented. They are nice images. So one message which is clear that while seeing retina, we must keep our eyes and ears open towards other things like teardrop, bat, and fireworks, and starry sky and whatnot. So that is the message actually. And may I request Dr. Sangeet sir to say a few words of encouragement for the viewers and also the winners.
Dr. Chitranjan, first of all, I'd like to congratulate all the winners of this image competition. I must say that winning is important, but winning, it is not really winning that matters, but wanting to win is basically the point. So winning does not always mean that you are being on the top. It just means you are doing better than what you have been doing earlier, right? So I hope that you keep on submitting more and more images, and we hope to see more good images. And the people who could not make this list, I would like to say that you lose only when you stop trying. So don't stop trying, keep on submitting the images. And with this, I again thank Dr. Chitranjan, Dr. Naresh, Dr. Manisha, who had done a lot of hard work bringing this competition forward. And I again request all the participants who participated in this contest. I congratulate them and hope that we will get a better response for our future competitions. Thank you.
Thank you, sir. I must thank Team Numeric, Mr. Sai, Manjula Madam, Saktibel, and other their team for this also. They have been working a lot behind the screen. Thank you to Team Numeric. And with this, I hand over to Dr. Manisha.
Just a minute, Chitran,
Yes, sir.
but there is there is a fatigue actually. I think what we have done is good, like having once in 3 months, because if you see only 3 participants are there watching this in the YouTube, and 2 are sitting in front of me actually. I don't know who is the third person. So I think too frequent also will be, I think, what do you call, create a fatigue. So we'll have this.
In future, they will be seeing, sir. In future,
Yeah.
they will see, sir.
Okay. Yes. Over to Dr. Manisha.
Yes.
So very hearty congratulations to all the award winners. And I think that this competition is just a combination of your documentation with imagination. I think that is all about this entire thing put together is going to be making you submit some excellent images that we have been seeing in the past also. And so don't stop submitting your images, and the submission of the images is open throughout the month. So we are not having any date specified when you have to submit and when it stops, because we would love to see your excellent images coming in. And just a hearty congratulations to all. And I want to thank the entire team for having assimilated all these beautiful images, which are really worth seeing. And I look forward to more images being submitted in the coming months. We also, had started a video competition, but somehow the enthusiasm has been a little less in the submission of the videos. So we would be very happy if you take out some time and, send in some interesting videos. We would be loving to have a competition, even for the videos, which are submitted. So once again, a very big thank you to the entire team of VRSI and also of Numerotech for putting this felicitation together. And I look forward to having it again 3 months later. Thank you once again.
Thank you all. Thank you. Have a nice.
Thank you, sir. Will this will come to the end of the meeting?
Yeah.
Yes. Thank you.
Thank you.
Thank you.